New at 5, if you think your child has allergies, you might want to double check. COVID is rising again in Oklahoma, and the symptoms this time around look like allergies.
Fox 23's Alexa Mostrom talked to a doctor about how to tell the difference and ways to keep your kids healthy.
If your kid is sneezing, coughing, or congested, they may have allergies or they may have something more serious.
Some of those symptoms overlap with things that look normal, like allergies.
Dr. Courtney Sauls at Ascension St. John says they've seen more and more COVID cases, and sometimes the symptoms mimic seasonal allergies or a cold.
We're seeing it kind of ramp up like wildfire right now compared to what we've been seeing this past summer or even the end of spring.
So how do we tell if it's allergies or something more? Dr. Sauls says there are a few symptoms that differ. A clear, runny nose is allergies. Watery eyes is allergies. Itchy eyes and nose is allergies. A runny nose that isn't clear and is gunky can be a cold, COVID, or infection. A headache can be a COVID symptom. And if your kid is sick to their stomach, that can be COVID or a cold. But a fever of over 100.4 is the main thing to watch out for.
A fever, that's going to be your big indicator that this is something more than allergies.
Dr. Sauls says if you think your kid has COVID, you should take an at-home COVID test. Or if their fever lasts more than 3 days, take them to the doctor. It's important to know if it's COVID because that can cause other illnesses.
It can progress sometimes to ear infections or pneumonia, and so we want to make sure that they don't have those other infections that might need a different treatment.
As for preventing COVID or a cold, Dr. Sauls says washing your hands and not touching your eyes and mouth is still the best prevention method.
Based on what your diet is, it's never a bad idea to take a multivitamin, especially that has vitamin D and zinc in it.
Covering news that matters, I'm Alexa Mostrom, Fox 23 News.